Going back into student train, now we want to do a transfer. And the reason we're going to do a transfer is because the patient is going to need increased or decreased level of care. So in order to do a transfer, again, let's go to our medication reconciliation tab so we can see what those orders are, these medications, and decide if we want to move these medications before we do a transfer. So let's say that we do want the patient to stop taking that furosemide before we transfer that patient. So in order to do that, again, we have to go do an order. It's an order we have to do. And we went to order management. I'm going to click on my problem, right click to add an order, and immediately go to this consolidated medication list, grab that furosemide here, and choose to discontinue. It's asking for the discontinue time. I'm going to choose now and OK. OK, one more time until we can get to our accept button. And now we see that this is listed up here. Now, before we get to our accept button, we have to go back to this order selection and choose to place the transfer order. And I'm going to do that by going to general orders, and we're going to take a look at this ADT here, and we're going to do transfer to another unit only and add order. And then it's going to take us through the order profile, and we are transferring to medical floor, ICU level 2 step down. And then once we choose that, add order, it's asking for a reason. So I'm going to choose type in testing. Again, it's going to take us through the order profile, and we've indicated surgery, no surgery upon admission. So that's not changing. I don't really need to indicate that information at this point, so I can hit OK through that. So if you don't put documentation in certain areas, it won't show a fallout, or it won't show anything besides, it just won't show that summary. So it's not like it's gonna, like you're missing any documentation. You just won't see it in the documentation summary. And then OK. As we can see here, it's going to associate that medication transfer with reconciliation with this medication transfer order. So we're going to hit OK. Now we've moved that medication transfer, and we discontinued that furosemide. So we're at this point ready to complete that medication transfer reconciliation. If we wanted to go into this order history tab and do any kind of modifications here, we could do that. Also, we could put in other orders here should we need more labs or anything like that. But let's go ahead and go to our order summary, because that's the only order I wanted to make a modification to in order to complete my medication reconciliation of my transfer. Okay. Now this time it didn't go right into that transfer medrec, and that's okay. Let's go to this medication reconciliation tab again and refresh here. And we can see that now we only have that singular that is as a visit med. And we don't see it down here. And again, sometimes this window just needs refreshed. However, we can go to this medication this inbox medrec alerts tab, and we can grab it from here, because now it's giving us that that alert that transfer medication reconciliation is ready to be documented and signed. So I'm going to click on that, double click again here. It's going to ask for the date and time, and I'm going to say now and OK. And now it's going to take me into that medication reconciliation transfer report. And upon this transfer report, we've only continued the singular. So I'm going to hit OK and accept. And now that transfer is completed. All right, one last thing we can go through. We just need to discharge a patient. And if we take a look at this discharge meds for patients, this is empty, and it's because there's been no medications that have been ordered for our discharge. So this is why it's important to do the medications first and then the discharge. And so this is how it looks before. Let's take a look after we put our discharge in. after we move our medications around. Okay, so again, I'm going to go to my medication reconciliation tab. These are the currently how these medications for home visit and discharge are actively on this patient. So we're going to go into order management first. We're going to add our order to our problem. Go immediately to the medication reconciliation list. And let's say that we want the patient to go ahead and continue these two medications, these discharge medications at home. So we're going to highlight both of these. And we're going to copy the discharge meds. And that information is filled out for us already. So we're going to hit accept. And now we simply said that you can go ahead and continue your home meds upon discharge. And let's go ahead now and add a discharge med. Let's add ibuprofen. So what I've done is in this medication, I'm going to put IBU in a dash for a wildcard. And then I'm going to choose ibuprofen. Try to stay away from these non-formulary because they'll get you in a loop and it's really hard to get out of that. So I'm going to choose ibuprofen. The medication type is going to be prescription required. Dose route, let's do 800 milligrams. And all I'm doing is double clicking in these screens and it's taking me to the next screen. We're going to say every 4 to 6 hours. So let's do we'll say every 4 hours. Or excuse me, let's do this one. Number 6, every 4 hours. And again, I'm just practicing using that underline there. Okay. That's going to ask us to choose the product, and I want 800 milligrams. And if there's no more directions here that I need, I'm just going to leave that blank, and same with patient instructions. I need the reason, and we ask that you never abbreviate. So if it's hypertension, don't use HTN. Always spell out the reason, which is a required field. Quantity, I'm going to put 20, and okay. Now, as we can see, it was ordered by Dr. Knight, and here is the original start date of that order, and it's electronically ordered. And I'm going to hit OK. And now we're going to get to our accept button here. Now, you might see that there is a dosing alert here, and as indicated, the daily dose of 4,800 milligrams is high. So we can choose to select the warnings to display that we are going to confirm, and then enter. Sorry, I didn't mean to select that. So we're going to hit OK, and then it's going to ask us why we're OK. So I'm going to just, we could choose one of these reasons or simply testing. Is a free text option that it gives me, and I know that because of here. OK. All right. Now we can see that we have these 2 discharge meds, and we didn't prescribe those. We just simply told the patient that they can continue those once they get home, but we have prescribed them ibuprofen. Now, real quick on this history tab, we don't have to do anything here. We don't have to discontinue anything upon discharge. These orders will be discontinued upon discharge. Just that's the way our system is set up. So order selection tab, again, I'm going to go to my hospitalist menu, general orders, my ADT here, and I'm going to put that inpatient discharge order in and add order. Now it's going to take us through that discharge order profile. I'm going to put for today, routine discharge, and then we're going to go into some instructions. So discharge diet instructions, if we had any, we would choose to document by clicking this button here, D to document, and I'm going to simply say, we'll choose number 1 and OK. Okay, again, do we want to do another one? No, so I'm going to hit OK one more time. Activities, let's D to document. We're going to do activities that's tolerated. So I double click on number 1. Okay, we don't want to do another one, so we'll do okay through that. There is no equipment, so I'm going to hit okay past that. And there's no wound care, so I'm going to hit okay past that. Now, there is some follow-up instructions I'd like to include, so I'm going to do D to document. and I'm going to indicate number 7, which is a follow-up has been scheduled. Hit OK and OK. I have no more discharge instructions or follow-up, but I do have a document discharge column D instructions. And this one I'm going to choose a few of them. So I'll choose 7 through 9, and I can do that here and OK. And I'm done with the discharge column D if instructions. So now we just got to continue this order profile, followed with PCP. We're going to say yes. It was a VTE, stroke, or MI. I'm going to choose no, no, and a no. And if I had any comments, I could place those there. And we're going to hit OK. And again, we can see that this medication reconciliation discharge is going to be kicked off here with this patient discharge. And order summary and accept. This time it did bring this admission discharge medrec to the forefront. So let's go ahead and double click on that. Let's choose to document and sign it now. So we're going to do D to document, and we're going to default to now. Hit OK. And here we see that we had a pre-admission med. It wasn't taken in house, but it was continued upon discharge. Also the singular, which was continued in-house, but we want them to continue their discharge as well. And then ibuprofen was added at discharge. So we're going to hit OK here. It looks accurate and accept. Now let's take a look at this patient discharge meds for patient. And here we see that it has the appropriate meds in there, and the patient and nurse will go through this together. The patient will sign, and that's why it's so important to move those meds around before doing that discharge order.